So there's a lot of really, great connection that I get to have with our clients, with our community, being a person that they might see out in the recovery community after they, leave our care or whatever. It's nice to see people who are getting the most out of our program, because I see treatment as like a starting point. Treatment is not an end point for somebody's recovery journey. Treatment is really just the beginning, and I see that really as the foundation that we're starting to lay for people. And for me, it's as an executive, as a business-minded leader, I want to make sure that I'm being accountable. And my job here is not to lead from an authoritative place. It's to lead in a way that says, I want to support my leadership team, empower them so that they can make decisions for their teams, their department, and understand the context of the organization. So we spent a lot of time across all of our departments building knowledge on what are the things that matter for our organization to operate. And that, I think, has really we've come a long way in that regard.
Welcome to the Brainwaves podcast by Opus, where we sit down with industry leaders to unpack their journeys, explore key challenges, and talk about how they're shaping the future of behavioral health and healthcare technology. I'm your host, Sean Rickenbacker, and today we're digging into the operational side of behavioral healthcare, how we build systems that actually support clinicians, improve outcomes, and make organizations sustainable. Our guest is Nick Howell, a behavioral health executive with deep expertise in clinical business alignment and operational design. Nick has helped a nationally recognized treatment organization scale efficiently without losing their mission. And today we'll talk about where things break in behavioral health ops, what it takes to fix them, and how leaders can think more clearly about supporting both staff and patients. Nick, thanks again for joining us. I just want to go over your background. So how did you first get into behavioral health and what drew you to the operations side of care delivery?
Yeah, awesome. Thanks, Sean, so much for having me. Excited to be able to talk a little bit about something that is a big passion of mine. My journey into behavioral health started through traditional corporate healthcare. And I spent a good majority of my career in the corporate healthcare world working on implementation and design of strategic initiatives to help enhance and build the future of the healthcare organization that I was with, and also worked really deeply and had some extensive experience working with process improvement, operational efficiency, financial improvement efforts. I'm a man in recovery, and COVID 2020, I moved back to my home community, and the organization that I'm with, Northern Illinois Recovery, had started in 2019, and they had an opportunity in their executive CEO role that opened up, and it felt like a really great alignment for me as something that is, an organization that I'm really passionate about, that was making an impact in my community in an area that was really exciting for me. Behavioral health care has always kind of been an interesting, uh, you know, thought area for me, I guess. And I never really wanted to go into the clinical therapist side of the organization, but it felt really connected and aligned to what my expertise was, what the organization had grown really rapidly in their first year and a half of operating. And I had a really good skill set that I could bring in from my corporate world to help stabilize and build for the future. And I took the opportunity, a leap of faith, and went to a startup healthcare organization and learned a lot about, the industry and the challenges that behavioral healthcare faces, and how do I, figured out how to really bring in some of that expertise from traditional healthcare models and figure out where there's, some connectivity, where things need to be different. And, we have been here for 4.5 years. And in that time, we've scaled to now operating 3 locations, a full continuum of care, bringing in adolescent services. And, we've been recognized as, for 2023 and 2024 as a top addiction treatment provider in the country, which is something we're really proud of, especially as a small, local center. So it's been a lot of fun to be on this journey. And, I feel like it's been a lot of the stars aligned to bring me here. And it's been a great opportunity.
I love that. I'll say I've only been in the behavioral health space since late October of last year, but I've talked to a lot of people that are CEOs, founders at recovery centers. And one thing seems to be pretty common across the board. Most people are in recovery. One thing that is also fairly common, not as common, is people started in corporate, ended up in recovery and then moved towards behavioral health. So I love to see the journey of, you see your own recovery and the benefits there, and then moving to helping people. So love that. Tell me more. If you're comfortable speaking about your recovery, I'd love to hear about it. If it's too personal, we can move on. But
No, yeah, absolutely. It's interesting for me because I got sober relatively young. I wasn't even able to take a legal drink when I got sober. I was 19, and it was uh, for somebody like me who found a path to life outside of just the recovery community. I went to school, and that schooling moved me away from my home community as I went and got my undergraduate degree. I've had the opportunity to travel the world. Was awarded a scholarship to study. I spent a semester in Hong Kong in recovery, and so most of my, almost approaching half of my life, I've been in recovery. So it's a little bit unique. But what is for me as somebody who worked in the corporate world, it's not, you don't talk about your personal life in any way, and you don't
yeah,
really disclose that recovery. So, going to happy hours and things like that with coworkers and getting it, engaged in those things was always interesting because I was, oh, I don't drink. I don't, and nobody ever really asked, but it was one of those things that I kept kind of close to the chest. And, as I get into the behavioral health and running a recovery center, there's a lot of, I'm very selective with when I kind of introduce that. I don't lean from that place of, I'm a person in recovery, with right from the jump, but there's a lot of areas where, a client might be struggling in the milieu and taking an opportunity to just have a conversation and to to just disclose like, hey, I'm in recovery too, I get it. There's this you can really watch people kind of take a breath when they see somebody that actually knows and understands that they what they're going through and what their life is going to look like. And so I'm not just somebody with a degree running a center to make a bunch of money, or I'm not a CEO driving a Ferrari around or something like that. I'm
yep,
operating as somebody who really cares about the care we're delivering, and to have the corporate expertise and the knowledge that I gained, and being able to do that in a space where, like, admittedly, not all treatment providers, but there are some providers that are in it for the wrong reasons, and we've really been a community responsive agency, and everything we've done, all of our growth has really been around responding to the needs of our community and the people that we're serving. And I think in that way, it really feels genuine. It really feels like we're here to connect with people. So that's a little bit about my journey of recovery. Like I said, I've been in recovery for 17 years now, and if I ever would have thought that I'd be in the position that I'm in, sometimes it doesn't really feel, as a person in recovery, we always kind of self-doubt ourselves or whatever. And so there's a lot of really, great connection that I get to have with our clients, with our community, being a person that they might see out in the recovery community after they leave our care or whatever. It's nice to see people who are getting the most out of our program, because I see treatment as like a starting point. Treatment is not an end point for somebody's recovery journey. Treatment is really just the beginning, and I see that really as the foundation that we're starting to lay for people.
love that. Love that. I mean, like you said, free as call, we take the journey one day at a time, like it says behind you. Tell me more. I know you said obviously worked in corporate healthcare. How has the change been in a startup? I mean, I came from a corporate background before I started working in startups as well. So I understand like the wearing many hats, but what is specific to the healthcare world as far as maybe somebody who is in the corporate side wanting to make the jump over into, I don't want to say hometown, but like a hometown center?
Yeah. Yeah. And I think that's for somebody who made that jump, I thought that I maybe had a naive perception or understanding that I was going to come to a healthcare agency, and that healthcare agency was going to just have everything in place because healthcare is healthcare. And what I've seen is a couple of things that are unique. Number one is I don't want to, I think that the behavioral healthcare sector of general healthcare, and it is healthcare, and people don't always associate it with it. Sometimes we call it like the redheaded stepchild. Nobody, it's the less glamorous side. We're not fixing knees and fixing hearts, but we're doing a lot for the individual in a way that saves lives just as much. And the challenge for me was coming to an organization that didn't really have all of the established processes in place. A lot of people who were really passionate, a lot of people who wanted to deliver the right care. But when we grew so quickly from 2019 to 2020, there was such a tremendous support from our community. There was tremendous support from the people that were coming to our care, and the people providing care were really passionate. But we really hadn't figured out how to do that consistently and making sure that all of our processes were buttoned up, documented, all of that. I say I worked for a company that had been around for 150 years. And then I go to one that's been around for 18 months. And there was a whole bunch of challenges that I didn't even think about when I came into this world. And some of it was as simple as building the foundational cultural pieces, and how are we going to ensure that we're hiring people that are aligned with our philosophy of care, are aligned with the work that we're doing. So that was a big challenge, was just the maturity of the organization is something that I wasn't fully prepared for coming into a startup world. That, and really this idea that we all have to wear multiple hats. And when I was kind of going through my interview process, one of the questions that one of the owners had asked was, I know that you have this expertise in building and getting this, but how are you going to translate that to the implementation? And I said, in my previous life, I would build solutions with C-suite leaders and other leaders. We would build models and we would build processes and we would turn them over and say, okay, here we've built this, you're in agreement. We've identified this department, this person, whomever, to carry out the vision that we've created. And I really didn't have the opportunity to see that through. And, there's this part of me that sometimes felt like, oh man, I've missed the other end of that, to see. Obviously, we monitor it and we track the metrics and we do the check-ins, but to be part of saying we've created something and now let's actually see it through, we would turn that, we'd call it a turnover, and we'd turn that over to that person. So we've had I've been able to see over the past 4.5 years, as where we're at today, how much of an impact we've been able to make, because I've been able to be there, in lockstep with the leaders and the rest of the organization as we've done this. And when I started, we were about a 30-person staff, and we've now
Mm,
grown to 85 to 90 people in the staff. We've tripled in size, and so that's been really great, because we still have a lot of our foundational pieces in terms of our culture. It still feels very connected to what we were when we started.
that's awesome. Tell me more about the culture. I know that obviously most recovery centers start with a mission. What's the mission of Northern Illinois Recovery Center?
Yeah, our very simple short form is to restore human connection. And one of the and this actually kind of relates back to your previous question, is I came from a mission oriented organization, and it was very clear what the mission was and what we were supposed to do. And more importantly, I think everybody from the C-suite to the housekeeping crew knew what the mission was, but more importantly, how that mission was impacted by the work that they were doing. And when I came over, I said, we need to become a very mission oriented organization. And, our old mission, our original mission, was to empower clients and families to achieve lasting recovery, which is great, but it really wasn't clear on how we did that. And one of the first things that I tried to take on was realignment or reimagination of our mission, vision, and values. And we got about maybe a month and a half into that. And there was a lot of disconnect, and there was a lot of, why are we doing this? There were a lot of people that were resistant to the change of, changing our mission. And so we paused that. And it was about 2023, we took on this really intentional work effort, that we took leaders from the organization, we took frontline staff from every department, each of our facilities, and we went on a journey. And it took us about 6 months of really intentional work to define our mission, to define our vision, and connect our values. And not only our values to just make them taglines, but to connect our values to standards of what we call standards of performance, meaning when we say we have a value of flexibility, great, that's wonderful, but flexibility to you, Sean, might look different than it does to me. So we took our values and we broke them down to, how do we want to live that value in our organization? And, what is really specifically the value of flexibility? We got to the end of our journey on the creation of these, and a staff member, one of our therapists from our inpatient location, said, hey, I think there's something missing here. Like, this is really great, but we're missing something. We embody flexibility. And so he actually was one of the people who created the value for our organization. And we all said, wow, yeah, how did we miss that? So it really was something that was created for our organization, by our organization. and had input from everybody. And the spirit of how we approached that was not what is it that needs to be aspirational. It was a little bit aspirational, but it was really built on the foundation of what is it that makes us our best today? Because we believed that we were delivering great care. We believed that we had really great staff, and we did, and we do continue to. But it started with how are we showing up as our best today? And how do we translate that to make it more consistent for the person who hasn't even started working for us yet, so that when they come in, they're very clear about who we are, what we do, how we deliver care, and how we want to show up not only for our clients and the people that we serve, but also our staff and our community at large.
I love that. I love that. Absolutely love that. And I know you mentioned that obviously it took a long time to get all the stakeholders to be aligned. And you'd also, in the call that we had previously, you talked about like there being a gap between the clinical side and the admin side. Obviously, we want to help people. It's also a business. We got to keep the lights on kind of thing.
Yeah.
What are the main disconnects between the clinical and admin side of your organization that you feel like you've really worked to overcome and bridge those gaps?
Yeah, and that has been a really incredible journey that we've been on. Our VP of clinical operations, Dr. Caitlin McClure, she's been with our organization from really from the beginning. She started as a contract therapist doing trauma groups, and she was placed into a director role prior to me coming in. And one of the things that we've worked on a lot was building the trust in communication. And so there's a lot of times when I have an idea or I have a direction that I think we need to go as an organization, and it doesn't serve anybody if we're not bringing people into that conversation, building trust. And so we really look at it as, trust, alignment, and candor, which for me is the kind of the three pieces that build our model of execution for things here. And we need to make sure that people are establishing trust, and we do that through candid conversations. We know that leading an organization at the table of the executive team is not always we're not always in lockstep. Sometimes we have differences of opinions, sometimes we see things differently. The important piece is that we continue to show up to the conversation, that we have candor to talk about. If we don't think something is going to work, then we need to be explicit about why that's not going to work. We need to advocate for our teams, but we need to be respectful and responsive to that. And I think that's the biggest thing is when we've shown, if we take something like caseloads, and in the clinical world, caseloads are always a very hot topic. How many people are on my caseload? How many clients am I seeing? And we used to talk in all caseloads, and it was very difficult because our clinical director would say, hey, not every caseload and not every individual that's on a caseload equates to the same amount of time. They might need more case management support, or they might need more family engagement. They might have more needs. They might be struggling with more mental health than others. And so it's difficult to say that one person equates to 3 hours of care delivery per week. So we ended up going to a way of thinking about it in terms of face-to-face hours. And we did that in a way that's really has been really creative, that we track face-to-face hours that our clinicians are having. We have a target, a benchmark that we want to be at or below. And when our clinicians start to bump up against that target or exceed that target, we have the ability to now have real data because of the documentation that they're putting in, and say, wow, Nick is really overloaded. He's been seeing 27 face-to-face hours over the past 3 weeks. We need to offload some of his clinical work so that he can become at the right threshold. And hey, John over here is at 18 hours. So now we can balance the workload a little bit better. And that has also translated to, if every one of our therapists or clinical team members is at that threshold, Caitlin can come to me and say, hey, Nick, we've been at this point for the past 6 weeks. And we believe that we track our data of admissions and caseloads, and we project that we're going to be at this point for the next 6 months. We need to bring in additional support, whether that's short term or long term, to say we're going to now hire a team member. We need to hire a team member because we have the data to support that hire. And then on the executive side, on the business side, to say, yeah, we have the data. You have a justified need. I'm always willing to make the investments in the organization where it makes sense, but don't just come to me It used to be, well, we need another person. How can you tell me that we need another person? What data do you have to support that? And so we've really spent a lot of time working through the disconnect in the language and the communication where I say, I don't see the clinical need. And she says, yeah, but there is one. And I said, how do we track that? How do we document it? And when we can build these systems where we're both on the same page, we both want the same thing. I don't want to burn out our staff. I don't want to just work people till, and burn and churn. And so what we've done now is we've actually been able to have a really great retention rate of our therapists. And the kind of unintended positive consequence of that is we have really good fidelity to our care model because we're not bringing in and having untrained clinicians trying to deliver care in a way that we really want to embody because we've have longevity, we have the ability to make sure that people feel supported, feel confident, and deliver care positively. So that's just one way that we've brought those differences of opinion or thought together. And for me, it's as an executive, as a business minded leader, I want to make sure that I'm being accountable, and my job here is not to lead from an authoritative place. It's to lead in a way that says, I want to support my leadership team, empower them so that they can make decisions for their teams, their department, and understand the context of the organization. And so we spent a lot of time across all of our departments building knowledge on what are the things that matter for our organization to operate. And that I think has really we've come a long way in that regard.
I love that. I love that. I think as well, like you mentioned, with kind of you calculating those face-to-face hours, make sure that your clinicians aren't experiencing burnout and churning, et cetera. Like I obviously at Opus, I got to talk about Opus a little bit. It's what I think about all day.
Yeah.
But we're always thinking about new ways to support the admin and clinical side to make sure that you guys can just focus on care. But I'm like, man, this is great insight because if we just put something in that makes sure that the admin gets alerted when somebody might be experiencing burnout, I think that could be super beneficial for everybody to have that data. I don't want to talk about this on this call or anything, but I'm just like, man, my brain's churning about this. This is awesome.
Yeah.
Great
And I'd
insights.
always be happy to help talk about that too, because the other piece of what I found in behavioral health is that there's not as much of a collaborative nature. People try and keep their secrets close to the chest, and it's a lot of really nice pleasantries, but it feels like people are holding back a lot. And I'm somebody who's like, let's all like we have plenty of people who are struggling and suffering. And if we come together in a way that really supports our communities and the people that we need, like it's not about numbers at that point. It's really about helping the people that need it. And that's really what I believe in is that we need to be able to share those secrets, those knowledge, how we're doing things, how we're enhancing our care, how we're taking care of our people so that they can take care of those that need it.
Absolutely. Absolutely. Like you mentioned before with the corporate thing, I mean, obviously I've been in corporate. I understand that it's like business, business, business all the time. That feels like if we keep those secrets close to our chest and not share like ways that we can provide better care, we aren't able to give that like hometown recovery center feel to our patients and that like high level of care, not just taking care of them, but really like feeling for them, having that empathy on their recovery journeys. Yeah, and I mean, my mind's reeling about all that now. So I'm like, there's so much more that we can give. So I really appreciate these conversations
Yeah, absolutely.
regarding it. Are there any? Obviously, like we all have these things that take up 80% of our time thinking about how to streamline certain things at the organization. Is there anything you're currently working on with Recenter that's like been a main point of like trying to optimize and help, whether that be on the clinical side or the administrative side?
Yeah, absolutely. So we've been on a bit of a journey from, and I'll kind of, unveil some of our, I don't want to call them skeletons in the closet, but some of our underperforming areas.
Hey,
About a
totally get that.
about a year ago, we started experiencing a really big uh, uptick in people leaving our care, what we call it, against medical advice or against clinical advice. People who were leaving treatment before they were, before their original agreed upon date, or people who would, leave pretty early on in their detox stay or, residential stay. And it spiked pretty significantly in like October, November of last year. And we created a committee for what we called our AMA committee. And that group of individuals really started to unpack and dive into what was occurring at each AMA and why it was occurring. Because in recovery, in the treatment space, it's really easy to just say, oh, they weren't ready, or "Oh, getting sober is really tough and they probably just felt bad," or it's easy to just make these excuses that make you feel better about poor performance, right? And what we want is we want people to stay in care because we know that the evidence shows that people who are engaged in services that taper down over time for an extended period have, generally speaking, better outcomes. And so what we did is we created this committee, and that group of individuals really started to focus on enhancing our experience and enhancing our what we were doing on the front end to take care of people in their first days, because we noticed a lot of people were leaving earlier on in their treatment stays. So that work really focused on enhancing a lot of things. And some of that was, well, we found that we needed to engage families earlier, because there's families are enablers, and they get pressured and they feel like, oh my gosh, I don't want to upset my loved one. And so when I call my mom and say, hey, I need to be picked up from treatment because this place is terrible and I just can't do it. And my mom goes, wow, I don't want my kid in a terrible place. They say, great, I'm going to come do it. So we created these really thoughtful family engagements to say, hey, these are the things that obviously, within the ROI framework, but these are the things that your loved one is facing when they express that they were maybe dissatisfied or having a hard time. We would call them and say, hey, Nick is struggling, and we know that there's a chance he might call you to try and pick him up. What we ask is that you kind of trust us in engaging with him. It's beneficial if you hold a boundary to not pick him up, because treatment is going to be what he needs, and rather than picking him up to take him home to go back to using. So that was an effective strategy that we had. And we started doing what we called AMA autopsies, and we would really study each situation to say, was this something that really was out of our control? Were there staff touch points that we knew earlier on in their treatment stay? Maybe somebody mentioned to one of our behavioral health techs that they were struggling with X, Y, and Z. Maybe they had a really hard group or individual session that they needed some extra follow up and support with. So we started to build these thoughtful touch points throughout their treatment stay to really support them, because we didn't want them to have a hard group or hard moment, to be going through something. And naturally, people just want to internalize that. So we made people more aware of what was going on with our clients when they were struggling, so that they could get extra support. And we started to see really great outcomes and improvement as a result of that. And that group has now translated to, well, what other areas of our organization do we have opportunities to support our staff and our clients to provide a better experience and make sure that people are coming in and it doesn't feel like, I mean, treatment is scary enough. When you're coming in, you're asking for help, which is incredibly vulnerable. And if you come in and you're feeling like, wow, it took, you know, 12 hours to search my belongings and I couldn't get my change of whatever it is. How do we enhance those things? And so we've built this really focused effort around operational excellence and reviewing our areas of risk, things that we either hear pretty regularly from our clients or we think are reoccurring issues. And now we have this great mechanism of leaders who are thinking about solving problems and how do we solve them in a way that is strategic and actually does solve the problem and isn't just an email to a team that says, hey, we're going to start doing this, but one that provides the training, provides, the clarity, the why. Why is this an important change? What's the impact on our staff and our clients? And so a lot of that work has been a lot of fun work that we've been able to start to engage
Yep.
in. And that goes back to like how do we enhance processes? How do we do some of that? So we're now at a point as an organization where we've built a lot, and now we're here to be able to stabilize and build for the future.
I think what you said about engaging with the family early is so awesome. Like making sure that you are not just actively engaged in the now with your patients, but more like, hey, these are things that they're coming up on. These are things that they're feeling. And of course, like you said earlier, making sure that your clinicians aren't burnt out. They've got that mental bandwidth to be able to engage with whether that be parents or partners of the patients, and making sure that they've got that care. One thing I see across the board, obviously, I've talked to a lot of people at recovery centers, engaging with the family being so incredibly important, because when they leave the recovery center, that's who they're going to be around. Maybe those people are enablers, maybe those people support them. It's a matter of getting them on board. If you're taking this journey one day at a time, making sure the people that are around you are helping you along. So absolutely love that. Again, Nick, I really appreciate your time and spending time chatting with me about your organization. It sounds like you guys are doing a lot of great work there. I know you had previously mentioned like it's like one thing you've really pushed for is bridging the gap between the administrative and clinical side. And I think that's definitely something we can work on in any organization. I did want to ask you one last question. I always ask this, and we're coming up on time. Do you have any book recommendations?
But yeah, it's I love books. One of the ones that we're working on with our leadership team right now is we're all kind of going through Crucial Conversations, if you're familiar with that book. But that's really a book that we're building it for how do we have conversations when emotions are high, stakes are high. And that helps, I think, a lot with accountability because it's very, in behavioral health, we are sometimes not short staffed, but it takes a lot of people, certain people want to work in behavioral health and certain people don't. And so we want to take care of our teams and we want to coach people in a way that helps build their skills. So how do we do that? How do we have conversations with our teams, each other, in a way that builds trust and builds common understanding around what it is that we're trying to achieve and the outcomes. Another really great book that I think I tend to reference, um, quite a lot is Dare to Lead by Brene Brown is a really great one. Liz Jaswick writes a whole series of books. Eat That Cookie, Leadership is Easy as Pie. There's a few, and those are really tailored towards healthcare organizations. But those are some really really great books as well. And then the other one I think is The Fearless Organization, really focused on building psychological safety and how we do that in an environment. So those are probably some of the more recent books that I've engaged with. And outside of your really common ones of on a personal level, How to Win Friends and Influence People is a
Yeah,
fantastic one. So yeah, my leadership team is one of the things I've done has been really making thoughtful book recommendations. And I preface that by saying, as a leader, for somebody, when we talk about growth as one of our values, we talk about organizational growth, we talk about professional growth, but also personal growth. And if I have learned anything in my leadership, it's that I have to be constantly seeking learning and growing. And I don't ask all of my leaders to read my books that I read and embody that, but to get curious about what else is out there. How can I start to build this mind that is agile and flexible where I want to consume information and try things as leadership books and other like leadership books are oftentimes I say like regurgitated information just written in different ways, but we want to be learning, we want to be trying new methods and figuring out what works for us to develop our own leadership style. And so that's really important for me as a leader as I work with my teams to build their skills because it isn't about creating a carbon copy of Nick. It's about creating leaders who are confident in their own abilities and can formulate their own plans with their teams.
absolutely love that. And I appreciate the recommendation. I'll definitely have to put some of those on the list. My wife reads some Brene Brown, so I got one of those books downstairs that I have yet to touch. So I'll have to jump in. But yeah, again, Nick, really appreciate your time. It's been fantastic having you on the podcast.
Yeah, thanks so much, Sean. I appreciate being here, and I'd love to chat. And again, off the podcast forum on anything I can do to help you and give any of my insights in as you working with Opus.
It's great. I'll probably reach out, especially in regards to that preventing clinician burnout thing that we talked about. I love that. I think that's a great insight. So
Yeah.
talk again soon.
All right. Take care. Thanks.